Primary healthcare keeps people in our communities as healthy as they can be. Through GPs, nurses, pharmacists, dentists and a whole range of health professionals, primary health provides us with the resources to manage our health and keep us out of hospital. I'm Matt Jones, CEO of Murray Primary Health Network, or Murray PHN, and this is our second Murray Health Report, the health of our region. Murray PHN is one of 6 PHNs across Victoria and among 31 across Australia. We all work to integrate local primary care services, encourage better use of resources and reduce duplication. Most importantly, we work to create better patient experiences and improve health outcomes in our region across almost 100,000 square kilometres along the Murray River and down to Macedon Ranges. As long ago as 2008, the World Health Organisation demonstrated that where we have good access to primary health care, the health of the population will improve. In Australia, our access can be world class, but it is unevenly spread. We know people living in cities have better and more consistent access to services than people living in regional and rural Australia. We believe rural health in Australia needs drastic and urgent reform to recognise the importance of local solutions for regional coordination, healthcare funding reform, and local co-design of primary healthcare services. The complexity of our health funding can prevent effective local solutions outside major cities. In our role as Victoria's largest regional PHN, Murray PHN is working towards the integration of local health networks across primary and acute services, whether Commonwealth or state funded. Our goal is that integrated health networks can help address some of the workforce challenges that impact upon the efficiency and effectiveness of primary care services. In our current financial year, our total revenue will be over $60 million, with almost $45 million in direct funding to support collaborative work in this area. We also employ a specialist workforce based in our offices in Bendigo, Mildura, Shepparton and Albury to work with health professionals and organisations across our 22 local government areas. As in previous years, we will continue to commission services that address the identified needs of our populations while we work closely with general practice, Aboriginal community-controlled health organisations and other health professionals to build workforce capacity in our region. We also gather the advice of our advisory councils and communities to help us understand the needs of our region. Our strategic health priorities are set by government and expanded through our annual review of health needs of the region. They include chronic disease, Aboriginal and Torres Strait Islander health, aged care and child health, alcohol and other drugs, primary mental health care, digital health, workforce, and general practice. We also recognise that health outcomes are impacted by underlying disadvantage and a lack of access to good food, shelter, education and economic resources. As we move towards living with COVID-19 in our society, it's vital that other aspects of good health and wellbeing are not forgotten by those in our communities. Regular health checks with trusted professionals can provide the skills and resources for people to manage their own physical, mental, emotional and spiritual wellbeing. And the early detection of most diseases means the chances of a full recovery are much higher. The insights and statistics that you will read in the Murray Health Report are drawn from data that we have compiled as part of our population health work and part of a recent analysis conducted by consultant epidemiologist Dr. Priscilla Robinson from La Trobe University. The report outlines important and often concerning data that enables us to determine areas of disease, illness and disadvantage, and where we can help shape more accessible and equitable services for people that need them the most. We hope you find this snapshot into the health of the Murray PHN region both useful and informative. Our earlier Murray Health Report, The Mental Health of Our Region, can be found on our website at murrayphn.org.au.